Assalamu alaikum, the communication day. First scenario, you are the senior medical officer in the medical wards. Patient name John, 67 years old, was admitted to the hospital with new onset jaundice. After further follow-up and doing ultrasound, it showed pancreatic mass. He was again reviewed by doing CT scan, which showed pancreatic mass compressing bile ducts with a liver metastasis. After assessing Mr. John's condition, oncologists decided for palliative therapy and ERCP for him. Break the bad news to Mr. John and counsel about the ERCP procedure. The task is to speak to Mr. Jonathan, 34 years old, regarding his further condition, address any concern he carries, he raised. Don't examine the patient, okay? Ready, Dr. Salma?
Hello,
Hello?
I'm Dr. Ahmad. I'm doctor in the clinic today. Can I confirm your name and age, please?
Yeah,
Can I confirm your name? You are you are a son of Mr. John, 67 years old.
yes, I'm Jonathan.
Okay, nice to meet you.
Mm-hmm.
Today we are here to discuss some issue related to your father condition and address your concern. Is it okay with you?
Okay, doctor.
Okay. Are you next of kin of your father?
Yes.
I think your father doesn't mind to discuss his health issue with you.
Yes, he's informed that I'm going to come to talk to you about his health.
Okay. Before we start our discussion, can you tell me how much far you know about your father's condition?
My father is a fit person. He's only 67, and suddenly he started looking yellow, and then we came to the hospital. The doctors did some tests. They said that he has jaundice. They did some tests. Then they did some imaging, and then they said that I should come and meet you.
Hello?
Hello?
Yes. After
Yeah.
imaging, what you said?
Yeah. They did some tests. They did some scanning. I don't know, and then they did some more scannings. After that, they said that I should come and meet you. I don't know about the results, so they did not tell me what happened.
Okay. Okay. Your result of your father now with me. Do you have any expectation?
I don't know why he's so yellow. Why suddenly? Because he never complains of anything. There was no pain. There was nothing that we thought. And now so many scans and what. I don't know what's wrong.
Okay. Do you want me to explain to you now?
Yes, sure. Thank you, doctor.
Okay. Sorry, 1 minute.
Dr. Salma, I pause the timer. Whenever you are joining back, let me know.
Sorry, Dr. Basim. Deeply sorry.
Okay, you can start back.
Okay.
I am sorry to tell you that the result of scan shows that your father has mass in one gland called pancreas.
Okay.
And this mass causes compression or to the nearby structure like liver, and also one called also tube in the liver also, uh, causing for him symptom what have that like yellowish in his eyes like this.
Okay. Okay.
And
So,
regarding this, our consultant decided that to admit him on oncology, what is doctor of the cancer, and
mm,
to give him palliative treatment. You know what palliative treatment, or you need to explain to me?
but doctor, you're saying my father has cancer?
Unfortunately, yes, yes, but
Mm.
we need to proceed for further also testing. But your father has a mass, and also unfortunately, there is even myths. You know what myths? That mean is breed of the this mass or this cancer to other organ.
Doctor, my father has cancer?
Yes, unfortunately, your father has cancer, and this cancer, unfortunately, now is breed to liver.
How come, doctor? My father is very active and healthy person. How come he has cancer? And
This is as a scan showing that your father has. You don't know before about this. I highly
now,
appreciate your. I know how you are suffering now, and what hard time you are passing through. Uh, Unfortunately, I'm deeply sorry to be one to break this bad news for you, that your father has this cancer
mhm.
in gland pancreas, and unfortunately it also is spread to other organs. So doctor decided to him to do like a palliative care. What is a palliative care or treatment? This is like delivering treatment that is
Mhm.
only to relieve the pain and to relieve the symptom and to relieve stress, to improve only quality of life.
So,
You are
what are you?
following me?
Yes, I know. You said he's going to improve the care. Means what will he do exactly? What the doctor is going to help my father with the
Well,
with the
yes.
cancer? How are we dealing with it? So you
Okay, we
can't
are
do
here to.
surgery?
Yes, now I will tell you. We are here
Mm-hmm.
to help your father and to do our best
Mm-hmm.
to help him.
Mm-hmm.
And also, besides this is care, I tell you what called
Mm-hmm.
palliative care. Also, we will do like is not a big surgery, but it is like a procedure.
To treat the cancer?
No, not to relieve the cancer. This is will relieve the compression of the cancer to the liver to improve the symptom.
Okay.
By doing this is what called ERCP. Don't bother by
Mm-hmm.
this name. This is like will doing like X-ray, and
Mm-hmm.
will make like incision in the abdomen
Mm-hmm.
after good preparation of fasting and
Mm-hmm.
everything. Will
Mm-hmm.
will insert like flexible tube.
Okay.
Yes, by through abdomen until through tummy, by opening it
Mm-hmm.
through tummy, and uh, and make relief of this obstruction. When this obstruction is relieved, a slightly yellowish discoloration of the sclera will improve because this cancer is cause compression.
And what about the
You
cancer?
are
You will
you are
not treat
following
it?
me?
Yes, yes, doctor. I understand that you are talking about the yellow thing that my father has jaundice,
2 minutes left.
and And you're going
Okay.
to help me with this, the jaundice to do the ERCP that you said right now. But
Yes.
what about the treatment for my father's cancer? You going to not do any surgery? Is surgery possible?
I highly appreciate your concern,
Mm-hmm.
and I am sorry to tell you that now the situation is not treatable only for symptom relief because already spread of the cancer happened. So
Mm-hmm.
now only not suitable for surgery to remove the tumor, only to relieve symptom and to relieve pain. Okay.
Okay, so you're just going to treat the jaundice, and you are not.
Yes, we'll treat jaundice, we'll treat pain also.
Mm-hmm. Mm-hmm.
Yes, we'll treat any symptom can disturb him and can cause stress for him.
Mm-hmm.
We will let him to live a comfortable life.
Mm-hmm.
Yes,
Okay.
but we
Okay, but
cannot treat for cancer. No, because already is spread. I'm sorry to tell you that.
okay, doctor. Okay.
Do you have Do you have any other concern?
Can he go back home, or we going to keep him here?
I, we will admit him because this procedure need admission, and after
Mm-hmm.
improve in symptom, and
Mm-hmm.
after procedure everything is okay.
Mm-hmm.
Uh, yes, after that can go home, but now no, still need to be admitted in the hospital.
Okay, doctor. All right.
Okay. Do you have any other concern?
Time's up.
Okay.
Yeah,
Do
time
your
is
father
up.
is financially supported?
Okay, time is up, Dr. Selma. And please, if you want to ask about support, don't ask about financial only. Any kind of
Okay. Also,
support. Any
yes,
kind of
financial,
support.
social, everything. Yes,
Don't
yes, all
mention
kind of.
any type. Just does your father need any support? That's it.
Okay, general, any
Okay.
support. Okay,
Yeah.
okay, okay,
Yeah, Dr. Aisha, you can comment now.
okay.
Yes, I think the most striking thing was like I think Dr. Salma thought that I know the reports, and she thought that I know that the patient's son know that the father is diagnosed with a cancer. So, Dr. Salma, it was you breaking the bad news to me. So you should have first given me a warning shot or something that your father has been diagnosed with a cancer, and I'm sorry to inform you this news. Or
Yes,
and you did not ask me, like, you want someone to be in the meeting. Like it's a very bad news, and on that it is already a very terminal cancer where no treatment is possible. So that one point was also missed, that you did not involve anybody, like you did not ask for um, anybody to join in the meeting. The other thing was the cancer news was not broken back, like, with a silence and with sympathy. The ERCP,
Sorry, Dr. Aisha, you cannot invite someone else while the father having the competence or capacity. Okay.
okay, is it because,
Yeah,
okay,
because you have news for another person. So
okay.
at least to get permission for to have this meeting. So you cannot invite someone else to spread this news, right?
Oh, okay. Yes, yes, makes sense. Yes,
Oh,
yes, sir.
perfect. Yeah, continue.
All right. Okay, and the other thing was like, yeah, the ERCP was explained, and yes, that was the only part. I think Dr. Salma got it confused, and she thought that, already I know the news. So I think more. Dr. Basim will tell more now. Yes, Dr. Basim.
Yes, yes, you're right. So no need here to invite, but
Yeah.
she started the introduction well when
Mm-hmm.
she asked about the permission from the father. This is
Yes.
very good, and you are the next of kin, which is also good. But unfortunately, she didn't use the golden silence, as you said, and the breaking bad news as warning shot and golden silence. So it might be minus in the clinical communication. Okay. Add to this the support, which she asked, but later on at the end, she doesn't have the time to do so. Regarding the skills, so clinical communication, I will minus here as borderline. What about clinical judgment, Dr. Aisha?
Yeah, I think she was good. She's
Okay.
satisfactory. Yes, according to me, I think she was satisfactory because she could
No.
explain.
Okay. Let me correct something she mentioned. She said we have incision for the ERCP.
Yes,
Yes,
Dr.
yes,
Basim, I want because I
Yeah.
feel suddenly I feel I don't know what exactly the
yeah,
procedure. I know that
Yeah.
we
yeah,
Yes, I will
pray
tell
and
you
we
now.
will.
So
Yes,
it's a
yes.
procedure
yeah,
through the camera scan through your food pipe from the
yeah,
mouth downward to the stomach, then duodenum going to
yeah,
the biliary duct. So no incision at all. It's not surgery.
yeah,
It's
yeah, yeah.
endoscopy.
Dr. Basim, what I will do if I didn't know the procedure?
You can just make it as a vague without details. So the
Okay,
procedure will be done by the specialized team. They are expert in this procedure. Before the procedure, we'll get consent from your father. We will
okay,
prepare your father. Don't say the steps exactly. Okay,
okay, okay,
you have to prepare before and during and after in this way, but don't talk about the details procedure. If you speak about
mm,
something wrongly, it will minus you. So here you can
okay,
say, we'll prepare your father, we will let him sleep in the hospital or admitted to the hospital. We will run some blood tests, and once he's ready, we will proceed with this procedure after providing the consent. And after the procedure, we will take care. We'll monitor him. After that, he can be discharged if everything is okay. In this way, don't mention anything. If you say something wrong, it will be against you. Like in this scenario today, you mention incision, which is not at all in this scenario. No incision here at all. Okay. So the stent will be
okay,
advanced through a camera scan through the mouth, going to the food pipe till the biliary duct or the duct or the channel in the liver to relieve the obstruction. That's why the father is having jaundice or yellowish in his eyes, and one of the palliative management to relieve this yellowish discoloration by doing this procedure. You have any question for this? No, doctor? Then we'll have a consent from your father, and we will proceed for this. If you want to know anything, we can let you know. So for me, I will minus you, as I said, maybe borderline again in the clinical judgment. The concern, okay, you address most of the concerns, so you can say satisfactory. The welfare as well, but please don't forget to ask about support, any kind of support. Okay. Any question,
okay.
Dr. Salma? So it will
Yes,
be
yes.
12
Thank
out of 16.
Okay, thank you.
Yeah, Dr. Aisha, you want to add anything else? Dr. Aisha?
No, no, sir, no, sir. I think you give the thing. The only thing was the yeah the if you don't know the procedure, we just have to say it vaguely. That's what you said, right?
If you don't the details, you can say it, as I
Ye-
said, during, and after. And at the end, you can offer him a leaflet brochure about detailed steps
Okay,
in
perfect.
this way.
And so here, like the consent was like the consent was his father has the capacity,
Yeah,
so he will
yeah,
be
the
the one
consent exactly will be
will be by the dad. Yeah.
yes by the dad.
Okay. Okay. Perfect.
Yes. Any question, Dr. Aisha or Dr. Salma?
Thank you, Dr.
No,
Basim.
sir. Thank you,
Yeah. Other
Doctor.
point, the palliative. The palliative, one of the teams assigned to treat like your father condition. They will be sure that he doesn't have any pain, even the Eulish discoloration. They will take care of this point to correct it, and the pain, the infection, the mood, they will be taking care of him to be as comfort as much as we can in this way. Okay, and the cancer from the start, no need to say it's a mass. You have the news that it is a cancer, right? a cancer with the spread.
Yes.
So you can say it's a cancer in the gland in the tummy called the pancreas, spreading to the liver.
Okay.
And
Directly.
we,
No need
yeah,
to.
directly, no
Okay.
need to say mass, mention it as a cancer. Once the cancer
Okay.
spread, it's not benign one and it's not a simple mass.
Yes.
It's a cancer.
Yes.
That's why you repeated the information again that he has a cancer and spreading to the liver. So from the start, I'm
Okay.
so sorry to say I don't have good news today or I have bad news today. Sorry for this. Then give her the golden silence. Again, warning shot. We mentioned the warning shot, then the golden silence. Then your father is having a cancer called pancreatic cancer spreading to the liver. Let her absorb
Yes.
for a while. Then you want me to explain what this finding? Yes, doctor, please. Explain it in your details or in your way, whatever you want to say, but try to be simple again. The next time will be more simple. So, pancreas, one of the glands in the tummy, it's responsible for some of the food breakdown, some also like controlling the blood sugar. So, in your father condition, he has the cancer in this gland. It's a very important gland in our body, and unfortunately, spread to the liver, causing obstruction to channel of the liver. And once this obstruction happened, unfortunately, he has this huge discussion in his whole body. And the consultant decided to be having or treated as palliative. Are you aware about this term? No, doctor. So palliative care is a team who take care of the patient condition, the mood, the infection. Even for this yellowish discoloration, he will be doing a surgery or procedure called ERCP. I will explain to you in steps. ERCP is a mini procedure which done for the yellowish discoloration, and you can mention that the name endoscopic retrograde pancreatography, right? Stenting.
Yes.
So yeah, so it's assigned or it's a procedure to relieve this the obstruction in the liver. If you don't know, as I said, you can mention it as pre, during, and after in this way. Okay?
Okay. We
Yes.
I mentioned that we will prepare your
Yeah,
father.
you will prepare, they
Then
will get consent, and he will be
yes, and then
admitted.
get consent.
Exactly,
Yes. And
yes.
okay.
Yes.
Okay.
Okay, any question?
Thank you.
Dr. Aisha?
So here social about social history only about support or kind of
Yeah.
support. Just
Who's living with your
nothing else.
father?
No need for smoking. No need for any
No, 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 no.
other
If you are
needs.
talking to the
Okay.
son, no need.
Yes. Yes. Okay.
Yes.
Okay.
Okay, and
Okay.
for the support, any kind of support your father need with whom he's living, at any time he needs
Okay.
support, let me know.
Okay.
Okay? Yeah.
Okay.
Dr. Aisha, Dr. Sama, you can
Yes.
post your scenario.
Yes.
Dr. Bassem, is there any room if I can add a few comment?
Yeah,
If
sure,
you,
sure.
yeah.
Go ahead.
So regarding the support, I think we've talked about this before, but you can touch base with support in this scenario either by signpost the patient toward the palliative team. The palliative team would assist. Usually, they call it Macmillan nurses. They if the patient does have receive a new diagnosis, they meet with the patient, they meet with the family, give them a detailed explanation about what is going to happen, and then they will seek or assist the patient for kind of support that is needed. Of course, involvement of occupational therapist would do some adjustment to the patient need, and they will arrange for that. For overseas centers, you can use the palliative team, as Dr. Bassem mentioned. You can acquire information about kind of support. Also, as Dr. Bassem mentioned, this is like a bit of additive information about what type of support usually cancer patient get or receive. When you touch, when there is, it's written in the scenario that says for palliative, palliative can start from palliative chemotherapy, palliative procedure, or they will not be treating. It's just symptomatic relief. So if he's for palliative treatment, then palliative therapy. So palliative therapy is a very broad term. Palliative therapy, this would include, for now, we will do a ERCP, and then if he recovers, they will have further assessment, further MDT, and then he might receive further few lines of chemotherapy that he can take if the expectancy is more than 6 months or 3 months, I guess. But it is based on the uh, um, you don't need these details to discuss it, but keep it in the back of your mind whenever you are saying this is we are not treating him. He's not actively dying at this time being of the at this moment of discussion with the relative. So don't treat it as he's dying because he's just came in with jaundice. One other thing is about the ERCP is being done by the surgeon. So I don't think we are expected to know details about surgery that it's not being done by medical one of the medical specialty. So it is fine not to know about it. If you are caught in such a position, there is the consultant who's doing the procedure will sit with you in a detail, giving you the details about the steps exactly, what's risk, but in generally, pre, during, and post, happens with any procedure.
Yes, if you have time, you can go ahead with the complication, but it's very difficult to have time to do all this
Yeah.
breaking bad news, cancer spreading, palliative, and the ARCP in
No, no, no.
details.
Yeah, no, I'm
Yes?
not. I'm not saying that to go through all of them
Yeah.
in one go as because this is the we've had a cancer scenario. So usually pancreatic cancer comes with two procedure, either esophageal stent or pancreatic stent, and it's very common cancer to come in the PACES scenarios because it can they can make the surrogate it has so many concerns. Is my father dying? So they can tweak the scenario very easily with the pancreatic cancer. Um, uh, uh, because in this scenario, the patient is not actively dying. So you are not telling basically the surrogate that your father is actively dying. But no, he had cancer. It's a spread. Unfortunately, give the surrogate a time to absorb, and then he will ask, is it curable? No. Is it treatable? No. But it is manageable. Unfortunately, it is and one of the concerns would be how long he's have to live. What you are going to do for this? Oh, I guess first of all, there's the first assessment by the oncology consultant that we are doing a procedure to relieve the symptom first, and then he will be having continuous further assessment. We will be providing continuous support. That's it. Did you get my point? It depends on what the
Yes, yes.
surrogate will
Yeah, of
ask.
course,
Yeah,
Dr.
he will ask.
Omar.
Yeah.
Yeah. It depends on the concern, of course.
Mm,
Yeah, some of the candidate or the surrogate will have a lot of concern in this scenario for how long the curable or the management. So it will also depend on your time, how to manage your time. Did you manage your time well to give a chance to the surrogate to explain and to express the concern or no?
yeah.
If you have the time, yeah, it's good to answer all these concerns.
Yeah. Since we are bringing a cancer scenario, those are just revising all of the possible aspects in further in different scenarios, also with the same nature. You know what I mean? With the cancer nature.
Yes, yes, of course. You have to be ready for those concerns. It's not only one concern; it's multiple concerns, and you have to be ready for everyone. Okay, thank you, Dr. Amar, for raising this comment and the concerns related to any cancer. And we have another cancer scenario. Dr. Salma prepared.
Yes, yeah, I think this is also a cancer scenario. So I talked to the daughter. Yeah. Okay, Dr.
Yes.
Salma, are you there?
Yes, yes.
Okay, so I will read the scenario quickly.
Yes,
Mr.
please.
Ahmed, 62 years old man, initially presented with mid-thoracic back pain. MRI spine showed a lesion at T5 and thoracic 6, and he was treated as suspected discitis with 6 weeks of intravenous antibiotics. CT-guided biopsy was planned but declined by the patient at that time. He was discharged and he was now represented with worsening back pain, repeated MRI spine showed progression of the T5, T6 lesion and a new lesion at the T8, T9, raising concerns for metastatic spinal disease. The case was discussed at the spinal multidisciplinary team, which agreed on CT-guided biopsy of the spinal lesion and CT chest, abdomen, pelvis to identify a possible primary malignancy. Patient already knows the latest scan and outcome of his condition. Now to the daughter, Mrs. Sarah or Miss Sarah. Okay, ready?
Okay.
Yeah, here you go.
Okay. Hello there. I'm Dr. Aisha, one of the doctors here at the clinic today. Are you Miss Sarah, Mr. Ahmed's daughter, who is 62 years old?
Yes, yes.
Miss Sarah, you're next of kin to Mr. Ahmed, right?
Yes, yes,
Could,
doctor.
could you please tell me that you have permission from your father to talk to me about his
Yes,
condition?
yes,
All right.
doctor.
Yes. Miss Sarah, before we start, could you please tell me how much do you know about your father's condition so that we both are on the same page?
Yes, my father had a back pain,
Mm,
and before he admitted to hospital, and doctor telling like there is like infection in the back, and given some antibiotic infection, given some antibiotic for this problem,
mhm.
and then doctor is plan for some image, but my father is refused to do it at that time and discharge. Now come again with this is pain again, and it's more severe now
Mhm,
and very bad pain, more than first one.
mhm.
Now I don't know what happened to my father.
So yeah, I really appreciate your knowledge, Miss Sarah, that you know that when he came last time, he had some issues and the doctors prescribed him the medicine. After that, um, do you have any idea why the why the other test was not done and and he was discharged? Was there any reason?
No, doctor. I know maybe my father is left before doing test
Mm-hmm.
or refuse at that time to do the test.
Okay, Miss Sarah. So
Then
now,
that test is not done at that time.
mm-hmm.
Yes.
So when
And
your
now
father,
come to the severe pain.
I'm very sorry for your father's condition. But now when he came and the doctors did again this imaging and scanning for your father's back, and the doctor and we found out that before there was the problem in some part of his backbone, which is called T at the levels. We in if I draw the I'll draw the spinal cord, and there are levels till C5, C5, C6 till T T12, and I will say that at C5 and C6 level at that time he had the problem, and now when the further imagings are done, we found out that there are more, the problem has spread to T8 and T9 levels of the backbone. Are you understanding me, Ms. Sarah?
Yes, yes, doctor.
So we got a bit concerned that what is this? So we did more further tests to find out what is happening with your father's backbone. In that discussion, we agreed that we take a snip out of that lesion and find out what it is. And I'm very sorry to say that the results didn't come the way we expected it to be.
What happened, doctora? What
Yes,
happened to my father? What is the result show?
I'm very sorry to give you this bad news, but your father has been diagnosed with cancer of the
My father
backbone.
had a cancer.
Yes.
Oh my God.
So
Doctor, maybe is this from first time and mistakenly doctor didn't know the diagnosis at that time. So my father is too much late for doing all this test because my father before I tell you that is also telling the like bug infection. Maybe at that time not a bug, maybe this is the same cancer and doctor not diagnosed good for my father.
I can at that time when the scannings were done, it did not show anything that could tell us that it is cancer. But I'm not very sure right now about it. I have to go back to the reports and find out just to double check. But at that time, it was suspect. We thought that it is just a bug infection, and the treatment was done. But when the next time when your father came with the same complaint, we were a bit worried, and that was the reason I think the doctors asked you to go for the further, asked Mr. Ahmed to go for the further tests. Are you getting me, Miss Sarah?
Yes, doctor. Yes. You mean this is not a mistake? You didn't defend your friend, your doctor? It's
I
not a mistake?
For certainty, I can't say that it is a mistake because at that time the scans did not show anything that could point towards the cancer. But I must say that I must double confirm if you are worried about it. Are you
Okay,
getting
doctor.
me, Miss
Okay.
Sarah?
Okay, doctor. Okay. Okay. Now
So
what?
so in order to find out like is this cancer going anywhere else, we did more tests, imagings of the chest, of his chest, abdomen, and his pelvic area, and we could find out, that the cancer has spread already.
Oh my God. That mean my father will die?
Um, I can't say for sure, but definitely I can only say that this will shorten his lifespan. Are you following me, Miss Sarah?
Yes, doctor. Okay.
So, what I would suggest is we would refer your father to the cancer doctor, and from there we will start his management plan. We will make an appointment, which will be a quick appointment to the cancer doctor, and they will start with a multidisciplinary team where there will be the cancer doctors, the specialized nurse, and the physiotherapist, and who will be taking care of your father's condition. And we will decide a management plan and take the care from there. How do you feel about it?
Okay, doctor. Thank you.
Do you have any concern, Miss Sarah?
No, no, doctor.
Um, uh, with whom your father is living? Who is taking care of him?
With me, doctor.
How are you managing to take care of him?
2 minutes left.
I'm caring of him. It's okay.
Do you need any social support? We could be happy to help you with it.
Okay, doctor. No, my father is support.
Okay. Anything else that you need? We can give you more information about your the dealing with your father's condition, like what care of management we will be providing him with some brochures and some leaflets. If you need any more information, so you can always come back to us with any concerns that you have.
Okay, doctor. Thank you.
All right. Thank you so much.
Thank you, doctor.
Still 1 minute, Dr. Aish.
Mhm. Um, your father is working? Is he how does he do, what does he do for his living?
Before is working, but now from feeling this pain cannot go to work.
And may I know what work he was doing?
Before is a teacher,
Okay.
but now no cannot do his job.
If he needs any social support, we could fairly help him with that.
Okay, doctor. Okay, doctor.
All right.
Okay. You can give him like sick leave to until fixing this problem.
Okay.
Yes,
Until
we
be
will
okay.
make a follow-up plan, definitely. Yes.
Okay, time is
Okay.
up. Almost. Yes, you can commit now, Dr. Salma.
Wallahi good what done, because this scenario also is not mistake, and this scenario look like uncertainty, because not a mistake really, because me also I share this scenario to discuss about it more. uh, but what done is good introduction and explaining, answering concern is good. You can comment, Dr. Basim, if you notice any something.
Yes, okay. So for me, as a clinical communication, she can get satisfactory the way of breaking bad news. But I want to ask here, what you mean by the spreading, or what you mean by the cancer? Is it primary or secondary?
I did not understand from the scenario,
Yes,
sir,
I think
because
so.
the scenario is not very clear. It says that the CT was done and the
Yeah, the
primary.
CT, I will tell you now.
All this scanning is done to confirm is it primary or coming from other place, because it's mentioned in the scenario many investigation.
I read it
Mention
twice.
CT chest, CT abdomen, CT pelvis, or is mentioned. So to confirm, I think is it primary or is it secondary from meds from any
It's
other
from the
provider?
Mets. Okay, that's what it said. Because when I read it twice, the same lines, Dr. Basim, like you're talking about the primary thing, and I still couldn't get it that the case is talking about, is it a primary malignancy of the spinal cord, or it has come from there? Like when I read it twice, I just felt that the case is saying that the CT of chest, abdomen, and pelvis has identified a possible. I thought maybe it
Yeah,
spread
what
already.
I understood that we are doing
Yes.
the CT cap, chest, abdomen, pelvis, to check for the primary.
Yes.
To and where is the primary lesion, sir?
That's why we are doing the CT cap. We don't
Yes.
know yet.
Yes.
So under investigation. You
Okay,
got
to find
most,
out. Okay.
yeah, most of the vertebral lesions, it will be secondary as metastasis.
Yes. Yes.
Okay.
Yeah. Yes, sir.
So
Yes,
we
sir.
are doing the CT of chest, abdomen, and pelvis to know where is the first one or the primary lesion. That's why I think in the clinical judgment, you'll be minus because you couldn't understand. You have to be ready for this. Okay.
Yes, sir.
And I
Sir,
think it's written there. It's written that
possible primary malignancy.
we are doing the CT cap and further investigation because we have the secondary in the bone. Okay.
Okay. So the secondary is from the bone. Yeah, that's what it is saying.
The
Yes, sir.
secondary, yeah, the secondary
Yeah,
in the bone. The
okay.
primary is still under investigation. We have to know where.
Okay, sir. All right.
Okay.
Yes, sir.
Okay, this is regarding the clinical judgment. You will be minus. For the clinical communication, you can get the full mark. The concern as well. So you can get 14 out of 16 in this scenario. Minus
So
only the clinical judgment. Yes.
So one more thing, I kept on interchanging like the name. Will it affect me? Will the scenario be affected? Like, because I was not getting that point clear. So sometimes I said, Mr. Ahmed, your father, or was it awkward? Like, how was it, sir? Or like, is it okay that way, or I just have to stick to one thing that I started with, like with your father, or I use his name?
Any of them, either your father or patient name, but don't say him or don't say the patient. Okay.
Yeah,
So
yeah,
don't make it as anonymous. Make
yeah,
it as known one. Your father or Mr. John. Okay.
yep,
So, show some respect, but don't say the patient to
yeah,
him.
no.
Okay.
Yeah, but if I keep changing, like
No. It's okay. It's
it's
okay.
okay, right?
Yeah, any of them, but you have to make it as a respectful one. What I want to say also here, don't ask as a permission question. Do you have the permission from your father to talk about your father? Assume it better because he might tell you, no, doctor, I don't have this permission. So what you will be doing, you will be in trouble, right?
Okay,
So the best way is we assume that we have permission from Mr. John to speak about his condition with you, as
okay.
you
So
are the next, as you are the next of kin. Is it right? So you answer. You did the 2 points, the next of kin and the permission assuming. Okay, I prefer to do in
Also,
this way.
we can say
Yeah.
also another sentences. I think your father doesn't mind
Yeah,
to
the first
person to
one
talk.
you did in your scenario was perfect. Yeah.
Yeah.
Your father doesn't mind to talk about his condition with you as you are the next of kin. So you assume both and you confirm both.
okay, perfect. Okay, we assume that your father is aware of you talking to us. Yeah,
Yeah,
or
either your father aware about this discussion or doesn't have or doesn't mind to discuss his condition with you as you are the next of kin,
Mhm.
or we have a permission from him to talk about his condition with you as you are the next of kin.
Mm-hmm.
But you have to confirm both information. Okay.
Yes.
Okay. The other concern, yeah,
Yes.
shorten the life. It's perfect to this answer because always you cannot say he will die, but he will be or his life will be shortened by the cancer. But for how long, no one knows. But the cancer usually, it's a nature. The cancer usually shorten the life. One more point for the first scenario. When he asked doctor, my father was fine, totally fine, till the presentation with jaundice. So how you can answer this? Usually the cancer present as hidden disease,
Mm.
right?
Yes, sir.
And
But
he might present later on after exploring the body or after doing some scans. But usually the cancer not presenting or not expressing itself unless we have exposed or explore it. You got it? This is the nature of cancer. So most of patients, they have discovered the cancer accidentally. Sometimes they are doing scan or doing investigation, or the jaundice itself appear after time of presentation, long time of presentation. Here also patient had back pain. He expected to have discitis, and later on it came as cancer. So this is the nature of cancer usually. It's not presenting as cancer from the start. Sometimes it's mimic or it can be hidden. Okay.
mm.
Yeah,
So
doctor.
it was not a medical error, right, sir? It was.
No. Yes, yeah. I think you mentioned mistake. Okay. If you mention mistake, I will minus you in the clinical communication.
No, sir. I did not mention it that it's a medical error. No, I
You
did
said
not
there is
say.
mistake. You said there is
No,
mistake, right?
No,
Okay.
no, I did not say that. I said no.
No,
if
she
you-
didn't say that. No, she didn't
Okay.
say that.
So-
Thank you, Dr. Omar.
okay. You
Thank-
remind me to comment on this part. Why? Never
no,
ever
yes, sir.
mention mistake from us or our side unless it was clear. Here, the patient himself refused the procedure. So why I have guarantee that this patient had mistake because of us or error, delay management. He is the one refused the procedure, right? Unless
Yeah.
it was written there, he didn't be offered alternative tool to diagnose the condition. Okay,
All right.
our job and task whenever the patient refused a procedure to find another way to diagnose him. But if he
Yeah.
signed refusal and he refused to be at the hospital, refused the procedure, refused the scan, what's our mistake? No blame
Yeah.
at all. No
No.
blame. Okay, so don't say, okay, this is mistake from us at all. It's not an error or it's not a mistake, and don't apologize. You can be sorry for him. I'm so sorry, but your father had signed a consent, a refusal for this procedure, which could help us to know the nature of his disease. However, we are here to treat him, to give him the maximum support he needs, to take care of him, and so on. Okay.
So in this scenario, I don't have to talk about anything about the care or anything else, right? Like, how are we going to
If he
proceed?
asked, how you manage my father, you can say we referred your father again to group of doctors. They are expert. They will take care of him. They will manage the pain he has. They will manage the possibility if he has support for the infection, for the mood. Again, it's considered as palliative. If he asked you, you can mention. If not, no need
Yeah.
unless he raise it. How you manage my father now? Because the plan now is to do the CT, chest, abdomen, and pelvis, and after that we can have another meeting to explain what the primary and what the management plan. Till now, you are suspecting and you are having metastasis, but you don't know the primary, and still not yet planned for a surgery or medical or chemo or radio. You don't know. So we are here now to discuss about the finding of the CT, which is secondary or metastasis. Okay.
Okay. Okay. Get it.
Yes. Any other question, Dr. Aish?
No, sir. Thank you. Thank you so
Oh.
much.
Dr. Omar write another nice comment. Offer Macmillan nurse, please. Yeah, any cancer scenario, offer the Macmillan nurse as a specialized nurse. Or offer further meeting will be in place since you have time, Dr. Aisha. Okay, you can say these words.
Yeah.
So we will refer you further to group of doctors, including the Macmillan nurse. They will sit with him, explain the further management, and if you need any support, let us know. And at the end, also offer leaflet brochure. We are here to support you. If you need any support, any leaflet, any brochure, any website, we can provide you to read about your father condition. And please, for both scenarios, and this word also, this advice for Dr. Salma, never ever talk to patient he has a cancer or you are giving or delivering news of cancer by saying nice to meet you. How you are nice to meet him while you are delivering bad news after a while. So we are here to discuss your issue. No need to say happy, nice, because after a while you will shock this patient. So no time here or nothing to give him the happiness. After a while he will be very sad. So you cannot offer the happiness or you cannot say happy.
Yeah.
Then
This,
okay,
this even in another case, even is not cancer. Better to not say it nice to
yeah,
صح?
I don't prefer it at all at any communication
Yeah.
scenario.
Okay. Okay.
Okay.
All right.
Yeah, conclude the meeting at the end. Yes, if you have time, you can recap. You can say what the summary to discuss further step. Okay, Dr. Ala, here the cancer not confirmed. So better to mention it as high possibility not confirmed. So again, it's a secondary, Dr. Ala. I cannot say this is not a cancer, but we are looking for the primary. Okay.
So yes, in
Yes,
this
Dr.
scenario,
Bassem, but it's already
yeah.
mentioned also in the scenario, it is highly concerning for spinal metastasis.
Yeah, so it's highly
Oh,
suggestive. Yeah, highly suggestive or
so
highly
it's not
possibility. Yeah.
confirmed.
Okay, you can say
And
it in this way, but still the cancer is highly possible or high
yeah, yeah,
likely.
No,
yeah.
Yes.
It
there is
would.
another, Dr. Ala, there is another
Yes.
thing mentioned in the scenario
Mm.
that it says that from the imaging, it is the feature is suggestive of metastasis. So
Yeah.
whenever they use
Suggestive,
this,
yes, yeah.
yes,
Mm.
I know. So when they use this phrase, if it's suggestive of spinal mets, then they don't like us to hide in the bush, and they get angry when we avoid using the word cancer. Because we tend to be afraid to use
No,
it without a biopsy. So they usually bring the scenario like this in order to see if you are sticking to the point or not. But in this particular scenario, if the imaging is suggestive of a cancer, like secondaries of the cancer in the spine, then we are afraid that there is cancer. Therefore, we still don't know where is the primary yet, or the origin of this cancer yet. But unfortunately, from the scan, it looks like a cancer.
yeah, it looks like also the same. Looks like suggestive, raising the possibility or concerning. But what I mean that not to mention that the imaging showed that he has a cancer in his back, or he has a cancer in his main nerve cable in the back.
No, no,
That's what I
you can,
mean.
yeah,
Yeah.
no, no, but you can say it. You can say it.
It's highly
But
possible.
it's to use it. What looks like a cancer is to because they you don't need to leave the surrogate with a doubt, is it cancer or not. You need to shock him with the news. Yes, it is a cancer, unfortunately. What is this is how it looks like. You know what I mean?
Mm.
Because they will pay very close attention if you try to hide behind the bushes and try to avoid establish the fact that there is a cancer or not. Because if you started this particular scenario that is written in this way with uncertainty, the surrogate will be having a ready response, but yet you are not sure, doctor.
Yeah,
You know what I
and
mean?
the other thing is if they are looking for primary, like maybe the
Yeah.
surrogate can say
And
that what are you looking for now when you're not sure, like
perfect. And I want to add one important information. The radiologist finding or the radiological finding, usually they have the impression from the radiologist, it could be or highly suggest to be cancer. So what I want to say, it's fair enough to confirm or to have confirmed diagnosis from the radiology finding. Sometimes they need to do the staging. They can go for the CT cap, and sometimes to know the type of the cancer itself, they might do the histopathology.
So this is why I wanted to use this opportunity to explain the journey of cancer. Usually, and even though you can use the word journey in the scenario, you are not alone in this journey. So the journey starts from suspicion.
Exactly. Yes.
Then, after the suspicion could rise from symptom,
Yeah.
or could rise from a scan, or could
Perfect.
rise from as a clinical suspicion. Then we ask, oh, I'm concerned that you do have cancer. Then the next step in the
Yes.
journey
Yes.
is to have a scans, and then to have initial management. This initial management depends on the type of the cancer. It could be a stent, it could be like the previous scenario, or it could be radiotherapy, as in this spinal scenario. You need to, if you've seen a spinal scenario, prepare yourself, because you don't know, is it your scenario or not? Is it what is like spinal meds? Okay, you do have like a spinal radiotherapy, sometimes neurosurgical intervention as a palliative management, or but this has to have an MDT discussion, which is will be discussed with the neurosurgeon. So the images will be reviewed by the neurosurgeon, will be reviewed by the clinical oncologist, and the clinical oncologist who's the one who delivers the radiotherapy, to have to see if the patient's spine is stable, and if it is stable enough to handle fixation, they will do palliative treatment, although the cancer is metastatic. So it is a palliative, part of the palliative, because palliative sometimes misconceptualized in our mind that, oh, the patient will die, especially if you don't have, if we don't, not all of us would have an exposure to oncology. And then, including myself, like 4 months ago, I wasn't knowing anything about this. But and the next step is to have to understand where is this cancer coming from. Okay, so this would have a serial tests. Uh, Either tumor markers would be sent alongside with scans, and then PET scans if CT scan didn't show anything. Some cancer might need a biopsy, would worth doing a biopsy in order to understand it, because it makes a difference in choosing the line of treatment. And you can use a vague word like there is a multiple line of treatments that is can be used for him, although that he is on palliative. That is because there is a palliative chemotherapy can be used, which is one of the line of treatments. So when you are discussing, there is some buzzwords you can use in this scenario, in cancer scenarios, which is line of treatments. But this line of treatment will be judged after reviewing the images. So it's the management of a group of doctors. But the main team would be the oncology team. And here, the rule of Macmillan nurse is to infuse this information, because it's very shocking news, on a set of sessions with the patient, with the family, because today he's having the scan, tomorrow he's having further bad news, next day he's having very difficult news. The plan even could change within 1 or 2 weeks. What they have told him this week can change in the next week. He's getting sepsis, so his chemotherapy that he's planned to receive will be stopped, and he will start to have PEs, and then he's now changed to a dying scenario. I hope this explained the vagueness about the cancer scenarios.
Yes, clear. Okay, thank you.
Excuse me,
Thank you, Dr.
doctor.
Omar. Yes, Dr. Salmi.
When I said look like cancer, maybe patient will not be satisfied and will ask again, what do you mean? It is cancer or not cancer?
Mm.
That mean like I
Cancer.
didn't answer good for concern.
No, you can say cancer.
Okay.
This is what
Spreading mean there is primary, so it's a cancer,
Yes.
but looking for the primary.
Yes,
Yes.
yes, Dr.
Yes, sir.
Bassem,
Yes, sir.
I agree with you. But
Yes.
if not mentioned, just my point, if not mentioned in the scenario that it is a confirmed cancer, I think it's better to not mention by confirmation it's a cancer. Okay. What if they took
But
biopsy and they found it TB, tuberculoma or something? We don't know. They will take biopsies, they will do CT for staging.
is it tuberculoma can
So
be spread because mention is spread of the
Yeah.
Yeah, no. Okay,
that's why,
let's summarize it. Okay,
yeah.
whenever
Yeah.
it's written highly suggestive, mention it as written in the scenario. Don't
Yeah.
add and don't make it as a confirmed, as Dr. Ala mentioned. Okay, I agree with this comment. Whenever something written, follow the scenario and stick to the task. Okay, it's highly suggestive, so say it's highly suggestive. Is it a cancer? It's highly suggestive. Doctor, tell me clearly, is it a cancer? What's written in the scenario? Deliver it. I am afraid to say it's highly suggestive of cancer according to the radiology or to the scan, doctor. Right? Clear now for all?
yeah.
So, sir, I should have phrased it like this, right?
Yes,
That
whatever written, as written exactly.
yes, it is highly suggestive from the CT, from the scans that we did, that there is some cancer, some highly suggestive, some lesions that are highly suggestive of cancer, but we
Yes.
don't know where it is coming from. So we'll be doing
Yes.
another test to
Yes.
find out from where this cancer is coming, and that's why
Exactly.
we'll be doing the scans for the chest
Exactly.
or blah blah blah.
Can I just
Once,
add something? If you mention that we have to look from where it came and you continue your discussion the way you are mentioning, it's an indirect way you are confirming it's cancer. So take care. You should continue talking in the uncertainty way. So it is highly suggestive of us. It's highly suggestive that it has spread and it's a spread from another cancer. So we don't have again insist that we did not confirm anything yet, but whatever we are seeing is a highly suggestive. It is a spread and it is highly suggestive. It came from another cancer. So you have to repeat using the same word. Otherwise, if you start with highly suggestive and you continue talking about that it's a spread from another cancer, you will be too much confusing to the surrogate. So you have to continue talking in the same way of uncertainty throughout your discussion. So it's a highly suggestive of a spread, and this spread can be also came from another primary, but all this data need to be confirmed. So don't let the patient catch any word which indicate a confirmation. Okay.
One thing in this scenario that's been written that I've just went through the scenario again, which is said the case was discussed at the spinal MDT, which agreed on to do a biopsy. So if you said if the surrogate said, "Is it cancer, doctor?" then this is why, to make sure the scan has been discussed in the MDT, and they recommended to do a biopsy to have certainty about the suspicion, and then at the same time we will be doing a band scan or a scan of the whole body to look for what possible source. So
In case
if we can
confirm
see
it's a
in
cancer.
the
In case we confirm it's a mets from the
no,
biopsy.
it's what's written in scenario. Can you refer to the scenario in what's written? The case was discussed at the spinal MDT, which agreed on a CT guided biopsy of the spinal lesion and CT cab to identify a possible primary. So in the way, if you started uncertain as you're suggesting and everyone is suggesting, then if the surrogate confronts you like, okay, he's pushing you to the corner, is it cancer or not? You can use this as an excuse or as a way to respond.
That both of them looking for possibility. We need to confirm or exclude by doing two investigation. One targeting the mets and one targeting the primary. So you have to be clear, right? But here there is a good concern usually is raised that, doctor, if you didn't confirm it's a spread from cancer, so why you are in a hurry to conduct a CT chest looking for a primary?
And also
No,
above
this
this
is the
is mentioned
protocol.
also
No, this is the
metastasis.
protocol. This is
You
the
are
protocol.
right. You are right. So you have to defend your protocol that despite we didn't confirm it yet, and despite we are still in a suspicious phase, but usually we deal with a cancer in a rapid, and we put our patient in a rapid pathway of investigation where we try to run all the investigation at one time to keep the ball rolling to find the diagnosis quickly in order not to waste time. So as a part of the protocol, we have to run everything together, but it don't mean that we are sure of our suspicion. We cannot be sure until the results of the investigation are out, because also this is a tricky concern. Usually the surrogate face us with such a concern, doubting the steps of investigation.
Yeah, perfect. Thank you, Dr. Hind. It's clear now. So whenever you start with the suggestion, continue till the end like it's suggestive and highly. Don't say only suggestive. If written as highly suggestive, mention it as highly suggestive. Don't say it's suggestive only. Why? Because you will give false hope. Okay, suggestive only different than highly suggestive or high likely to be. So be as a scenario explained. Whenever written as highly suggestive, mention it as highly suggestive. If mentioned as suggestive only, you can say suggestive only. Because you don't know how are you sure and how much you are sure this is a possibility of 50, of 90, you don't know. So what's written you have to do. The only diagnostic test to finish the CT cap, as Dr. Hind mentioned, or the histopathological one. If you have any of them or both of them, this is the time to say it's a confirmed cancer. Okay? Any question or any added
Dr. Basim,
information? Yes, Dr. Salma,
here
yes.
mentioned like confirm cancer by MRI. Then when proceed to biopsy, just like to grade the tumor is which grade now and which type of the cancer.
Yeah, that's why we are saying it's a spreading one. And we have to
Yes.
run The other CT chest and abdomen pelvis to know and to localize
for the
the
source.
primary. Yeah, the primary.
So,
Okay.
so sir, right now I got more confused. Like now we say it's suggestive of cancer, or we say that it is it's a secondary from somewhere coming from somewhere primary. What should we say it exactly? How should we frame it?
What's
Like
mentioned
then?
here? I will read it, Dr. Aisha, for you.
Yes,
Represented
please.
worsening back pain, repeated MRI spine show progression of the T5 to 6 lesion, a new lesion at T8 to T9, raising concern of metastatic spinal disease. So we are talking about metastatic spinal disease. You cannot say it's a primary one because you have also MRI suggestive of metastatic, right?
Yep. Yes, sir.
Yeah. Which agreed on the CT guided biopsy of the spinal lesion to do it later on, or CT chest, abdomen, pelvis to confirm and to identify the possible primary malignancy. So it's clear in the scenario. Okay?
Yes, so it's clear that it is a
Yeah.
cancer coming from somewhere.
From primary, but we have to know it. And there
Yeah.
is also another confirmatory test, which is the guided biopsy to confirm our diagnosis.
Okay, perfect. Okay, so yeah.
CT guided
And,
biopsy.
and
Yes.
as you said that if it's a cancer, we just say upfront that it's a cancer, not to
Yeah, if
mix
confirmed,
it
you
with
have to
any.
no, yeah, yeah.
Yeah,
If
you
it's
just say
confirmed, you have to
upfront.
mention it as confirmed. Yes.
Yes. Okay. Okay, sir.
Okay.
Thank you, sir.
Thank you, Dr. Aisha and Dr. Salma. Any other question or comment? Anyone want to comment?
Thank you very much, Dr. Bassel.
Okay, thank you, Dr. Salma. Thank you, Dr. Hind, also for clarifying the point. Thank you, everyone, and in particular, Dr. Aisha and Dr. Salma for practicing today, and Dr.
Thank you.
Omar as well,
Thank you,
Dr.
Dr.
Ala,
Bassel.
everyone attended today. See you tomorrow, inshallah, with a short
Thank
clinical
you.
day. Thank you.
Thank you.
Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you.